Okay, so we're here with Dr. Mauricio Baggio from Curitiba, Brazil.
Brazil.
Mauricio has been visiting me this past week, so he's been with me in the OR, and we've had a chance to see some facelift and neck lift cases, no?
Yes.
You come very well recommended from Ruth Graff. Ruth Graff is a very good friend. Hello, Ruth. We'll say hello to you. But she really spoke very highly of you. She called me directly and told me of your interest to come and visit me.
Mm-hmm.
So you are from the great school from Curitiba with Ruth Graff. I know you trained with her, as many other great plastic surgeons in Brazil. What was your idea of coming to Madrid and coming here to see me?
Yeah, firstly, I heard about your name and read some papers. When we go sometimes to meetings and we talk about, oh, Bravo do like that, the other surgeons do like that. So your name was really hype, like everybody knows, like in this world of facial surgery,
right.
Aesthetic facial surgery. And then after I did a course with Ruth Graff of cadaver dissection, and you were one of the presenters, but
right.
you're away.
That's
so
right.
And I really enjoyed the presentation and saw that like the way you treat the neck, and that I would like to see that to improve my results, and so how amazing your results are. And then I asked Dr. Ruth to if she could like do this midfield that we call, so talk to you, and
right.
And we have the fortune to be here, and I get to watch some surgeries and to see your techniques, and exactly what I wanted to see.
That's
neck.
Great. No, but I mean, Mauricio is a very experienced plastic surgeon. So I mean, you're already like almost 20 years out in private practice. So yes. I've seen your results are outstanding. You do great work, especially very good breast and very good facial rejuvenation surgery. So tell me what you thought about. I mean, we had some interesting cases, young patients, a male we just finished a female patient where we did a neck lift and a brow lift. What is your idea? I know that some of the techniques are a bit different, right? Don't you think? Yeah.
Yeah, not different, but I think it's yes, different. The dissection, the approach, way you do it, the approach, the anatomy, it's like a clean surgery. Is like, congratulations, amazing. The way you operate, like the anatomy, all the things. But as we know, like the neck is becoming like the as you told sometimes, that is the new frontier in plastic surgery. Like many times we see incomplete neck surgery. We see as neck surgery that you do a good case, it stays like good for 6 months, and then suddenly it drops all the way.
Just goes away.
So I thought I could come here and improve my techniques in the way you do. So that's the way I thought, and it's much better than I thought. The surgeries and the way I was, how can I say, also welcomed here.
Of course, we welcome very much. Great plastic surgeons like yourself. We're very happy, and it also, I think it's very useful to, for me as a plastic surgeon to have visitors that are so knowledgeable and not already and a more advanced stage of their journey in facial plastic surgery, which is, as you just mentioned, it's very, very challenging, right? I think that when you're doing facial rejuvenation, especially in neck rejuvenation, neck lift surgery, oftentimes it's very disappointing when you start trying to do these techniques that are very complex, and then you don't see the results, the reliability of the results long term. And I think that's what you need to sort of try to have, that sort of urge to improve your results, improve the outcomes, because again, neck lift surgery is so demanding, right? And even in experienced surgeons like you that have been doing a lot of facial surgery, there's always that sort of trying to improve your results, and that's why I'm really happy to see outstanding surgeons like you with a great practice in Curitiba that are still trying to challenge themselves to get even better outcomes. So I know actually that, and we can talk about a little bit about that, because I know that in Brazil, the demand is so high on you as plastic surgeons, right? I think the patients are so knowledgeable in Brazil, and there's so many great surgeons and so much culture with the great Ivo Pitangui and all the great plastic surgeons that have come out of Brazil. Tell me a little bit about that, about the challenges of being in that environment. We talked also a little bit about how different sort of the ideals of beauty sometimes between, especially in breast surgery, they have sometimes different ideals than here in Europe. How do you see all of those issues in practicing in Brazil?
Yeah, firstly, practice in Brazil is like you said, so many good surgeons, like the school in Curitiba, like you said, many well-known surgeries around the world. So there are so many good surgeons like that. We don't know, but we know they're good, but they're not have all this knowledgeable all over the world, but still very good surgeons.
Very good.
Brazil has a big culture of plastic surgery. Like everybody wants to do that. Everybody wants to do that. Not everybody can, but if they could, that would be not enough plastic surgeons.
Right. Yeah.
I can tell you that. But anyway, as you said, the culture it depends much of the patients. Some patients, they want like more the facial, like more like I did plastic surgery. Some others
more visible.
don't. More visible. Some don't. Some expect more like a
very subtle change.
Subtle change. So that's when the time you gotta talk to the patient and you understand what the patient wants. But you gotta be able to give the results they want. For example, if I get a patient that wants really pull the neck, I have to know that. And if I have a patient, no, doctor, I want just a simple change just a little bit, I also have to know how to give that to
give that outcome that the patient wants.
Exactly.
But also what I really like that we were talking before, you're also, in command of the results that you think are better for the patient. Like you told me that even you might say no to some patients that want, very kind of visible out with a very big upper pole projection, although a lot of patients want that you might tell them, I might not want to give you that result because long term it doesn't stay well. Sometimes there's some problems with that type of kind of technique long term with larger implants, right? So I like that oftentimes you kind of lead that conversation, right?
Okay, yes, for sure. That's true. In Brazil, like we have this a patient that she wants, for example, breast surgery, very natural results, and also they have very big breasts, like with a big upper pole projection, and that's it's a big challenge for the surgeons because sometimes you have to take too much breast tissue and put a big implant, and you tell the patient, and she really wants that TV show breast like that's so big and artificial, and sometimes you have to say to patient, no, I'm not going to give you a result like that. It's not going to be possible. You got to tell them. Otherwise, you're going to be two problems. You have one breast that she doesn't like, and the patient that's completely satisfied, and some kind of sometimes even surgery that you cannot go back. Like if you take so much tissue, there's nothing to do about it.
If they want to remove the implant, it's going to have a problem. Yeah,
exactly.
That's true. So yeah, I think it's good. And as you're saying, you're a very honest plastic surgeon, and you're willing to tell the patient, maybe this is not the best for you long term, and maybe the patient doesn't understand, and then she'll go see another. Because if we know one thing, if the patient is really centered on finding something, she will find it.
She'll find somebody who.
Yeah, there's always people willing to do things that maybe are not in the best interest long term for the patient.
Exactly.
But I think we need to sort of, stay professional and really understand and try to keep what's best for them long term, right? So tell me a little bit about your training, because I know that we all go through these stages. We were talking also during the surgery about our journey in our specialty. We both have a very strong background in reconstructive surgery, right? You've done a lot of reconstructive surgery, which I think is very good to improve your outcomes in aesthetic surgery, right? But then you're very, very, very well known in breast surgery. You do great work in breast surgery. But you also do outstanding work in facial rejuvenation, no? So how do you see kind of your journey? No, you're pushing more. I think you're getting more and more busy with facial surgery. Is that something you're thinking about?
Yeah, sure. I think the first thing is that the facial surgery, it's a more refined technique, and you gotta do more cases to be good at it. Yeah. It's not that the first case is not the first years of your after you finish residence that you're going to be so well. And it's like it's a longer journey,
longer learning curve. Yeah.
Another thing that I learned from a surgeon that was my kind of mentor, and that he was like a surgeon in Curitiba. His name is Odilon. Dr. Ruth worked with him. Dr. Ana Zumira. A lot of people, good people in Curitiba, worked with him. And so he told me that their patients, they age with you. So you start when you start on your career, you have like liposuction, breast implants, and then breast. Then they get pregnant, and then they get mummy makeovers, and then when you're getting old, they are going to look for you to have like facial surgery and to bring their children.
That's true.
That happens. I think now I think we have like the facial surgery is also, we are delivering better results, and it's safer. It's both. Many people are looking for that because with deep plane, with deep neck, and all these improvements, people say, no, that's what I want to do. Other times it was like those all pulled like with so the people kind of have this stigma of too much
overdone results.
Exactly. And now with the deep plane, we have like these young patients that we're talking about. They're excellent results, amazing results. We have this as we're talking about the deep neck, deep planes, like, so people are looking. You have more patients coming for facial surgery.
You know, that's a good thing that you brought that up, Mauricio, because I do agree that a lot of times, you know, when we travel and we go to different places in the world, a lot of, you know, countries, they might say, oh, you know, here, you know, we do more body work and breast work, and people are not demanding so much facial, you know, rejuvenation surgery. And I say that oftentimes that depends on the results that the plastic surgeons locally are providing to their population, right?
Yeah.
And you know, that's why, for example, in Turkey, they're so good in rhinoplasty. You get any, you know, 35-year-old young plastic surgeon, they're doing like 500 rhinos a year, and they're getting incredible outcomes, right? And of course, then the patients it's sort of like a positive feedback loop, right?
Exactly.
They know that their results are natural, because what patients don't want anywhere in the world is an artificial result that people can see that they've had plastic surgery. Exactly. So if the plastic surgeons are able to provide those results, then of course there's going to be much more patients looking for that type of surgery. And I think, as you just mentioned right now, I think we are in a stage in plastic surgery where we're able to provide those results in facial rejuvenation. Even in young patients where years ago, you know, they would not be, you know, considered candidates, right? Because they would look like artificial. I think now we can provide very natural looking results with facial rejuvenation and neck rejuvenation surgery. And I think that's why we're seeing these surge on these patients, right? Is that happening also in Brazil?
Yeah, for sure. That's what we're talking about. The results are getting better. The patients are feeling much more kind of have more confidence on the results, on the surgeons, and it's a positive loop. That's going to grow each time and more demanding for the surgeries. But as we were talking about, facial surgery, deep plane, deep neck is like a long learning curve. It's not like that, you know. True. So that's something we gotta think about it, because I've seen, like, even sometimes it's crazy because you see people that don't do deep plane saying they're doing deep plane, it's going to so it's going to lead some maybe mistakes or some false
understanding, misunderstanding by the patients.
That's something that we gotta care and
be careful with that.
Give better education to the new people that want to be more in facial surgery. I think it's very important because it's a really big bigger learning curve than breast and then body contouring and all those things.
No, but again, I think that says a lot, and also about our Brazilian colleagues, all our great friends from Brazil. We're going to say hello to all of them. But what I do understand is that, and every time I go to Brazil, and I'm with all of my colleagues, or you coming visitors that I receive a lot from Brazil, I do understand that they have this commitment with training and trying to get better at what they do. And that is something that I commend, and parabéns for you, because again, you have a great practice in Curitiba. You could sort of get comfortable and say, I'm happy with what I'm doing. I have all my patients I want, but you have this urge to be better. And I think that in Brazil, even young surgeons or even experienced and more senior surgeons like you always have this drive to improve your results, and you invest in your training like I think anywhere in the world. So I think that's great, a great thing that you have in Brazil, and I congratulate you for coming all the way from Curitiba to Madrid, and I hope it was useful these days with me.
That was amazing. I came here. I have some expectations. It exceeded my expectations. The surgeries that you do are amazing. As I told you before, the timing, the way you do the dissections, the way you expose the structures. I mean, that is a big lesson that I'm going to take for the rest of my life. And hopefully that's the only time I come. Maybe another time you take me here again, because I know you are a great surgeon, and I still have a lot to learn from you. Thank you very much.
Wonderful. Mauricio, we'll see you soon. Take care.
Thank you very much.